Hi. Aim of this video is to demonstrate how a case reporter and a contact reporter working on COVID-19 cases could use Diona mobile visit solution to record WHO recommended FFX protocol assessments for patients and contact tracing. This video is recorded on a tab but can also be used on a smartphone or a Windows 10 laptop. User can choose to give a unique name or an ID to the case being created. In this scenario, I'm entering a unique ID for this case, such as a case ID or a cluster number. Now we're registering a person as a confirmed case. We are now adding address to the person that we registered as a confirmed case, and with an expectation that the case follow-up form should be filled on the day 14 to 21. I'm now filling A1 form, the case initial report form for confirmed COVID-19 cases, which is filled on day 1. We selected the registered confirmed case, current status, and further case classification, capturing all data collector information. If the person providing the information is not the patient, we capture the interview respondent information. And we pre-populate all the patient identifier information that we captured during the registration of confirmed case. In this section, we capture all the healthcare center or the treating physician's details. We have a set of conditional questions or sections that are being popped up or asked based on the answers that we provide for certain questions. For example, here, specifying name of an institutional outbreak is asked only if you answer S for this particular question. If it's no, it skips that particular question and moves to the next section. In this section, we capture all the different patient symptoms. Here are a few questions on respiratory symptoms. And the section for other symptoms. Section to capture complications, if any. Capturing patients' pre-existing conditions. In the next section, we capture healthcare interactions. We can also record multiple primary healthcare visit details based on a control question. So once we fill up one primary healthcare visit details, it asks for, if any further details are required to be captured. If you select yes, the questions are repeated. And if you select no, it skips or moves to the next section or next set of questions. We're capturing any domestic or international travel details. These are the fields where you can have multiple answers for a question, basically multi-select questions. These are the control questions for molecular and serology testing. So we can have multiple records of these testings being recorded. As I mentioned, if we answer yes for the control questions, it allows you to record multiple testing details for both molecular and serology testing methods. Here's the last section where we fill up the status of completion. At any point in time, user will be able to view and download a PDF version of the form that is filled. After user submits the form, system performs two actions behind the screens. One is it sends a notification message to the contact reporter to start contact tracing, and creates a visits entry for day 14 to help the caseworker track the follow-up form filling. We'll see in the following videos how the case reporter fills the follow-up form for the confirmed case and contact reporter fills other recommended forms. Moving on to the next form, that is A2 form. A2 form is the case follow-up form for confirmed COVID-19 cases that is filled on day 14 from the date of filing A1 form. This might be filled in one go or updated regularly as more and more information is gathered. Starting the form by selecting already registered confirmed case and gathering the data collector information. We capture the interview respondent information if different from the initial interview, followed by the outcome status information. In the following sections, we capture patient symptoms during the entirety of illness, which could be the respiratory symptoms, other symptoms, and any complications. Any pre-existing patient conditions, and secondary bacterial infection information. In these following sections, we capture virology and serology testing methods and results, and we can capture multiple records of these informations based on the input we provide for the conditional questions. And finally, we complete and submit the A2 form by providing the status of form completion information. Moving on, Contact reporter is responsible for doing the contact tracing and fill the relevant forms that helps in early identification of potential COVID-19 spread. This process should start as soon as possible, ideally within 24 hours after laboratory confirmation of the primary case. As a first step, we register the close contacts of the confirmed case with type contact so we can fill the relevant forms for them as a next step. Starting with B1 form. B1 form is the contact initial reporting form to be filled for all close contacts of confirmed COVID-19 cases. As you can see here, while filling the form, we first be selecting the confirmed case for whom the contact tracing is being done, and then we'll be selecting the contact for whom we fill this form. We will then proceed with capturing data collector information and then interview respondent information, contact details, general exposure information, and the exposure information if the close contact is a health worker. Details related to respiratory symptoms and other symptoms. If contact has been ill or is currently ill, we capture the outcome or status of contact. Details of any pre-existing conditions and multiple entries of virology and serology testing methods and results. With the details of status of form completion, we complete and submit B1 form. B2 form is the contact follow-up reporting form for close contacts of confirmed COVID-19 cases that is filled on day 14 from the day of filling B1 form. This might be filled in one go or updated regularly as more and more information is gathered. We start by selecting the name of confirmed case and name of contact, followed by the data collector information details, and the interview respondent information, exposure information details, symptoms in contact, which are multiple in records, any symptoms in contact, respiratory symptoms and other symptoms, any contact pre-existing conditions, multiple records of virology and serology testing and corresponding results, with the final contact classification at final follow-up and details of status of form completion, we submit the completed B2 form. With this, we complete demo of WHO recommended FFX protocol assessments, and we conclude with the next video where we would see how this data can be accessed or extracted for analytical purposes using a web portal. Hi. In this section, we'll have a look at a web portal that can be used to access the data captured via the mobile device and more importantly, extract the assessment data in a format that can be used for various analytical, statistical purposes. On login, user will be presented with a list of confirmed cases recorded, and opening each case will present a view of all the contacts recorded. User would also be able to see the list of forms filled for each of the confirmed case or contacts. An admin user will be able to extract, or in other words, download the data captured in the assessment forms in CSV format. Such data can be downloaded for every type of assessment form filled, and it can also be customized to combine or customize the content as per the needs. Data thus extracted can be used to derive valuable statistics, providing insights such as distribution of cases by time, person and place, case hospitalization rate, secondary infection rate, etc. With this, we conclude our demo on WHO recommended FFX protocol assessments on COVID-19 using Diona mobile visits solution. Thank you for watching this video.